Hello dear students, welcome to our YouTube channel, Department Anatomy, SRMDC. I am Dr. Mustafa. Today we are going to discuss mandible. So in mandible, first we discuss about anatomical position of the mandible. Now I am holding like this. Okay. So upper border is alveolar border. Okay. Lower border is the base of the mandible. Two coronoid process which is on front and cadaveric process backward. So I am holding in hand. This is the anatomical position of mandible. If you want to hold like this. Okay. Now the mandible term, Greek word mander. Mander means masticate or chew. In Latin word we call as a mandibula, means lower jaw. Now we go into the feature of the mandible. The mandible contains body, ramen, two coronoid process, two cadaveric process. Now we are going to discuss one by one. It features an important structures which is repeatedly asking in practical examination. So now first we are going to discuss about body of the mandible. Now body of the mandible, when you take from this, before going to the feature of the mandible, we have to know peculiarity of the mandible. The mandible is only horizontal bone. There is a movable bone in the skeletal, facial skeleton. It is a U-shaped bone. It is a U-shaped bone. In fetal life, it has two hallways. Now see, in the between the two hallways, see the ridge. This is called symphysis mentae, which is joined together form a one bone. Now we are going to about discussion about body of the mandible. The anteriorly mandible and posteriorly ramen. So this body contains upper border, lower border, external surface and internal surface. Now first we are going to discuss about external surface of the mandible. Now see, this body has contains upper border and lower border. If we are discussing mandible, we remember number 2. Everything is 2. 2 border, upper border, lower border, 2 surfaces, external surface or internal surface, 2 ramus, 2 coronoid process, 2 condylate process. 2 lines, one external oblique line and another internal oblique line. So remember the word 2. When using the mandible, you remember 2. So everything start 2. Okay. Now this bone and the midline joint fusion, okay, is called symphysis mentae. Below the symphysis mentae, we have a elevation that is called mental protuberance. The mental protuberance, now see, all of you see here is the elevation. This elevation is called mental protuberance. This mental protuberance is indication of human jaw. Now either side infralaterally we have a tubercle, that is mental tubercles. Now come to the upper border. Upper border is called alveolar border, because this provide sockets for tooth. These sockets have different septas according to teeth. Okay. Now see here, below the incisor teeth is a depression is there. It is called incisive fossa. Incisive fossa. Okay. Then we have a between canine and incisor we have a foramen, that is called mental foramen. Okay, mental nerves and vessels emerges from there. Now from the mental foramen below we have a line, a ridge started, goes backward and continues as a anterior border of coronoid process. This line is called external oblique line. I will show you the marker. Now see, this is the line which is present on the body of the mandible. This line is called external oblique line. External oblique line. Here, three important muscles are attached. One is depressor labii inferioris, depressor anguli oris, and rest of the part is buccinator muscle. These are the muscles which help in your mastication. These some muscles are related to your facial expression also. Facial expression also. Now, this body has ventral foramen. This portion is related to your external oblique line. The lower part of the body is called base of the mandible. Base of the mandible is the thickest one. Now, posterior to the third molar, below this area, okay, before the ramus will start, this area belong to the your facial vein, facial artery, ascending and going to there. Now, the part of the third molar tooth, this area, buccinator will be go like that. Now, buccinator, the muscles fibers overlap here. Now, these are the features of external features of the body of the mandible. Now, we are going to inside the mandible. Now, in the center, we have some irregular elevations. This elevation is called genial tubercles. This elevation is called genial tubercles. There are 4 in numbers, 2 above, 2 below. 2 above, 2 below. Because the tongue is above, so this genial tubercle is above, is related with the genioglossus muscle, origin of genioglossus. Whereas the hyoid bone below the mandible, so lower genial tubercle gives geniohyoid muscle. Geniohyoid muscle. Okay. Now, below this genial tubercle, we have either side, infrolaterally, we have a fossa, depression. That fossa is called digastric fossa. Now, in external surface, we have a line which is called external oblique line. So, internally, we also have a line which is start from the lateral part of the digastric fossa, goes upward up to the posterior border of molar tooth. Okay, this is called mylohyoid line. I will show you, mark and show you. Mylohyoid line. This mylohyoid line gives origin mylohyoid muscles. This line separates the mandible into 2 regions. Above, sublingual fossa, below submandibular fossa. The 2 glands are large according to the names. Okay, the name the fossa depends upon the glands. The sublingual fossa, sublingual gland will, salivary gland will be large. The submandibular fossa, submandibular salivary gland will be large. Okay. Now, come to the ramus of the mandible. Now, this quadrangular shape of ramus, it has 4 borders: anterior border, posterior border, superior border and inferior border, and 2 surfaces. External surface are called lateral surface, internal surface are called medial surface. So, a little here we will change. In body we discuss external surface or internal surface. When come to the ramus, we call as a lateral surface or medial surface. Now, we are going to discuss about lateral surface. Now, this lateral surface, the whole area just below the mandibular notch, the whole area, okay, is attached by muscle of mastication. Masseter muscle will be insertion. Now, the rest of the area, what happened? This area is belong to parotid gland relation. Okay. Now we says the superior border, anterior border, and the posterior border, and inferior border. Now anterior border, as we know from the external oblique line, which is continuous as the anterior border of coronoid process. Coronoid process nothing but is a triangular shape of area which is present on the front of the mandible. This rami has this process is called coronoid process. Okay. So either side of the body, right and left, we have a rameys. Okay. The coronoid process has anterior border, posterior border, lateral surface, and medial surface. This entirely coronoid process, attachment of your temporalis muscle, one of the muscles of mastication. Okay. Now, this superior border is a notch shape, the sharpest one. The posterior border of the coronoid process continues to form the anterior border of condylite process. This notch is called mandibular notch. This notch is mandibular notch. Okay. Now, condylite process. Okay. This condylite process contains the condyle shape and just a depression. This is called head of the mandible. So below this impression we call as the neck of the mandible. Now another fossa, that is called pterygoid fovea or pterygoid fossa. This is the allowed your insertion of lateral pterygoid muscle. Okay. Now come to the posterior border and continuous descends downwards along with the inferior border form the angle of mandible. Angle of mandible. Now, so ramus quadrangular shape. It has four borders: anterior border, which is continuous from the external oblique line, and coronoid process have posterior border, which is continuous as a anterior part of your mandibular notch, and posteriorly continues the anterior border of condylite process, whereas posterior border continues descends downwards from the condylite process, joined with the inferior surface, form the angle of the mandible. Now we go into the inner aspect of the rami, that is medial surface. Now medial surface are irregular shape in the angle, near the angle. Now this is the roughened area. What you see? This is the roughened area. This area belongs to medial pterygoid muscle of mastication insertion. Now we have in the middle of this inner aspect of the rami, we have a foramen that is called mandibular foramen. For dentist, each and every dentist is necessary to know about mandibular foramen, because the inferior nerve, that nerve is called dentist nerve, which is passing through this. The inferior nerve is the branch of post-addition of mandibular nerve. The inferior nerve along with inferior artery passes through this. Okay, passing through this to reach the ventral foramen as a ventral nerves and vessels. Now, this bounded by mandibular foramen, a sharp edge that is called lingula. Now, I mark this lingula to show you. Lingula of the mandible. Lingula of the mandible. Now, here one important ligament that is called sphenomandibular ligament, which arises from the spine of sphenoid and attached to the lingula. Okay, it's an important ligament of your temporomandibular joint. Show this properly. Now this area below this mandibular foramen, we have a groove that is called mylohyoid groove or This is for mylohyoid nerves and vessels. Mylohyoid nerves and vessels. Now, posterior part of the mandibular tooth or molar tooth. This area belongs to your lingual nerve. Lingual nerve. The posterior part of the mylohyoid line, just above, we have another muscle attachment that is called superior constrictor of pharynx. Superior constrictor of the pharynx. Now, this is the general discussion about mandible.